As we all know, the growing elderly population of Sri Lanka is becoming an issue. To speak about this and to also speak what are the solutions we can apply to this, today we have consultant physician Dr. Dilhar Samaraweera, who is specialized in geriatric medicine. He is also the founder president of Sri Lanka Association of Geriatric Medicine. Hi doctor.
Hi.
So I would like to ask you, first of all, what is geriatric medicine and why is this important?
Yes, geriatric medicine is a specialty in medicine. It is a specialty which deals with treatment and prevention of diseases in older persons. When we mean older persons, they are over 60 years of age. Now, why is it very important? Now, currently the elderly population is 12.5%, but in the years to come it will increase. In 2041, 1 in 4 of us will be over 60 years of age. Thus, we are going to see many diseases in the elderly in the near future. Already, we are seeing many older persons with physical problems, mental problems and social problems. And these problems need comprehensive assessment and care.
Also doctor, speaking of the gravity of this issue, in order to cater for the demands of these elderly persons, all the older persons, what changes are necessary to be made in the hospitals?
Yes, now I mentioned about comprehensive geriatric assessment. Comprehensive geriatric assessment can only be delivered by a multidisciplinary team. A single person cannot deliver comprehensive geriatric assessment. So what is this comprehensive geriatric assessment? It's about assessment of the person's medical problems, physical problems, mental problems as well as social problems. For this, we need personnel with different specialties and different skills. So therefore, we need consultants specialized in geriatric medicine, doctors who have been trained in geriatric medicine, nurses, physiotherapists, occupational therapists who are trained in geriatric medicine. In addition, we will also need other personnel like dietitians, speech and language therapists to enable detection of problems of these older persons. So the human resources need to be strengthened in these hospitals. In addition, we also need to develop an infrastructure which is elderly friendly. Elderly people should have access to health care, and also we need to provide them with the equipment such as handrails, grab bars, and for them to come ramps, all of these, and seating facilities, elderly friendly toilets. All of these infrastructure changes also should occur in the hospitals to help this elderly population. So we need to reorientate our health system. In the government sector, already we are seeing these changes happening. In the private sector, we have a unit, the Ceylinco Assured Care Center, which fulfills all these criteria.
Doctor, you mentioned that the Ceylinco Assured Care Center fulfills all the criteria. What is unique about it?
Yes. Now, we all know about the channel services. People go in search of consultants and they go for channel services. But in a channel service, you only see a single doctor. But in the Ceylinco Assured Care Center, we see the patient as a team. There is a multidisciplinary team which will see the patient together under one roof. So we have a consultant specialized in geriatric medicine, a medical officer who is trained in geriatric medicine, and we also have a nurse who is specialized in geriatric medicine, and a physiotherapist. We all see the patient together, assess the patient, and when we assess the patient, it is not only the disease that we assess. We assess the patient's diseases as well as the patient's physical, mental and social problems. And then we come to agreement on what we should do for the patient, and we manage the patient together as a team. And this is what is so unique about the Ceylinco Health Assured Care Center.
Doctor, could you also tell us what is unique about this Ceylinco Assured Care Center?
And that's why I say that Ceylinco Assured Care Center provides a unique service to the elderly population.
Doctor, what should the general public know about this Ceylinco Assured Care Center and the services it has to offer?
Yes, Ceylinco Assured Care Center provides the services with a multidisciplinary team. Now the difference is that when a person comes in, especially an elderly person, may have many problems, and these problems cannot be solved by a single person. So we need multidisciplinary team with specialized skills in different fields to deal with this patient. Now what happens is, usually when a person goes to a doctor, the doctor will refer the patient to another service, and then the patient has to go in search of this service. But at Ceylinco Assured Care Center, there is a team which will see the patient together. Now when we assess the patient, there is a basic health checkup which is offered. In addition, we offer a comprehensive geriatric assessment. Now in this comprehensive geriatric assessment, there is a brochure given to the people to understand what it is. We assess the person's medical problems, the diseases, the physical evaluation. Now in this, we assess the person's mobility, stability, balance, all of these aspects. Also we assess the person's sensory problems, which are vision, hearing, and also other problems such as incontinence is also assessed. In addition, we also give prominence to assessment of mental problems. Mental problems such as problems with memory, which which is commonly known as dementia, and also problems with mood, depression. All of these are also assessed at this center. Now a person who comes to this center might not have any of these problems, would be a very healthy over 60-year-old person. Still, that person may have good health, but we will promote the good health. Also we will give the necessary advice for this person to have an active, healthy life in old age. So for this, we would provide this person advice about promotion of good health habits, as well as dietary advice, advice on exercises tailor-made for that individual and his or her lifestyle. Now also with the multidisciplinary team, we are able to give these people who come to us advice on physical exercises. So there are packages. One is the basic physiotherapy package, which is offered to healthy people who are active, for them to understand what exercises they should do, which are tailor-made to that individual's lifestyle. And also people who are old and who are frail, who are having physical disabilities or limitations in the activities of daily life, we will offer a specialized physiotherapy package, which consists of providing them assistance to walk, to maintain balance, to maintain stability, and also advice on assistive devices, and give them ability to help them to do their activities of daily life. Even occupational therapy will be important in this aspect. All of these will be provided. And also, as you know, elderly people have problems such as osteoarthritis. So they are unable to do certain activities and they have pain, and we will give them the necessary physical exercises to alleviate these pains, and also the pharmacological treatment, medicines which are needed to treat diseases like osteoarthritis. Of course, there are other diseases, neurodegenerative diseases like Parkinson's disease, and also you would have heard about problems like incontinence, where people are not very willingly coming forward with these problems. All of these problems will be dealt by our team, and we will provide them assistance. Finally, we also provide advice on nutrition. We do a basic nutritional assessment and also nutrition assessment in regard to diseases, and we will provide them advice with dietitians who are with us, advice on nutrition specific to certain diseases that they would have, or if they are healthy, advice to promote a healthy life according to their lifestyle. All of these services are provided by a multidisciplinary team under one roof, and that is the wonder of Ceylinco Assured Care Center.
Doctor mentioned that the government sector hospitals have been started to practice these changes. So I would also like to know, have you identified a center in the private sector to meet these needs?
Yes, I would like to mention the Ceylinco Assured Care Center as a center which provides all these facilities. Now, in the Ceylinco Assured Care Center, we have a multidisciplinary team, and also we have an elderly friendly atmosphere.